Welcome, dear students, to your masterclass by Medicoapps. I'm Dr. Mohammed Sarosh. Today, we are going to learn about occupational health, specific health concerns for the people who are working class. All right, let's go. Let's go. All right, so the physical agents like heat, like the people who are working in conditions where it's a lot of heat, they are at risk for hyperpyrexia, that's fever, then exhaustion and stroke. The people who are working in cold climates, the chilblains and frostbite are the risk, and they can get that. Those who are working extreme light, the risk of cataract, minus nystagmus is there. For those in pressure, like the deep sea divers, they have the risk of having Caisson's disease. It's a question asked, guys. So everything I'm putting in one slide for you to refer very easily before exams. So noise, it causes deafness. Radiation causes cancers like leukemia, aplastic anemias, and the others are the burns, injuries, and various accidents which can be preventable. So let's see the chemical agents. That is the gases causing poisoning, the dust causing pneumoconiosis. Okay, we'll be talking in detail about pneumoconiosis also. And then we have metals like mercury causing heavy metal poisoning, chemicals also causing that. A biological agent, it's a brucella, anthrax, and the leptospira. All these three infections are known when people are working in like with animals, like veterinary doctors and nurse and people who are in contact with the animals. Then you have the occupational dermatitis, which is mainly in metal type of exposure. Occupational cancers and many cancers, skin cancer, bladder, and others. We'll be talking that in detail too. The other in occupation also is because there's a lot of stress. They have the neurosis and the hypertension. Let's talk about the dust leading exposure of dust leading to a disease called pneumoconiosis, and this is a set of that. We'll talk in detail. The size of the dust, if it is less than 0.5, it's easy to move in and move out of the lung and airways. 0.5 to 3 micron is the dangerous one. Okay, so remember the number 0.5 in this. Okay, 0.5 microns it is. If it is more than like 3 to 5, it is trapped in the mid respiratory tract. More than 5 is trapped in upper respiratory tract. So the ones which are reaching the bronchioles are the risky ones. The common pneumoconiosis, let us talk one by one. Okay, the first one is silicosis, like the name suggests, because of silica dust. People working in cement factories, bauxite miner industry, and sand, glass, and that. Okay, the most common disease which found to be associated with this silicosis is tuberculosis. Very important. Anthracosis is caused due to the inhalation of coal dust, and what it causes is progressive massive fibrosis. And anthraco means coal, so coal mining industry is the place of exposure. Asbestosis causes mesothelioma and lung cancer. Bicyanosis is cotton fiber dust inhalation that is found in textile industry, isn't it? Bagasosis is by the inhalation of the sugarcane dust, or bagasse, which is formed after you take out all the juice. In sugar mills, the people who are working there are at risk. All right, so more, that is farmer's lung, which is moldy hay, which is inhaled, the fungus in the hay. Okay, and that fungus name is important too, that is Micropolyspora faini. There's some more lung disease by the name the lung, the farmer's lung, compost lung. Compost lung is because of the fungus in the cow dung, okay, or the compost, sorry, and that is there. And then we have bird fancier's disease or bird fancier's lung, when the parrot droppings or the bird droppings are inhaled, and that cause disease. Siderosis is nothing but inhaling the iron dust, people working in the iron ore mining areas also. So let's talk about some bullet Important question, like most common organism associated with bagasosis is Thermoactinomyces saccharine. If you see it in the name itself, you have the sugarcane, sucrose, saccharine. Okay, you can remember this way. Bagasosis is sugarcane dust. Most common cause of death and disability among all is by silicosis. Notifiable diseases which are under the Factories Act 1948, 1 year after our independence. This act came into existence, and these are all the diseases, mostly what we have discussed just now: silicosis, anthracosis, asbestosis, and bisonosis. The snowstorm appearance is found in which of the pneumoconiosis in X-rays? Silicosis. Remember, silica is like sand, the sandstorm, snowstorm. Similarly, we have appearance in the X-ray. Bisonosis is common in the people who are working in textile industry, and it is seen in spinners. That's also a question being asked. For bagasosis control, we need to spray something called propionic acid that will prevent the moldy, the fungus growth in the bagasse. Okay, so now let's talk about the lead poisoning, leaded petrol. Remember that you have, as you see in the petrol pumps. So most common source is the petrol, gasoline, or vehicle exhaust smoke that you're exposed to, and the inhalation happening of that. And there is a blue line on the gums. It's called the Bartonian line, and the first sign is pallor, as it's a most consistent sign. The wrist drop and foot drop is there because of the nerve palsy caused because of lead. And colic and encephalopathy is also there. The pain in the abdomen and nervous symptoms will be there. And screening test is by using copropurifin. If you find that in urine, you say it's due to lead poisoning. The cutoff is 150 microgram per liter. So the diagnostic test is aminolevulinic acid in urine. Cutoff is 5 milligrams per liter. Lead can be also checked directly in the blood. If it is more than 70, we say it is lead poisoning. In urine, if it is more than 0.8, it is lead poisoning. Mainly the RBCs are affected. How do you see there in the RBCs? You have the basophilic stippling. You can see this blue dots on the RBC. It's basophilic stippling because of lead. And you see a picture of microcytic hypochromic, and there's a sign of pallor, anemia clinically also, right? So more about this, the treatment of choice is EDTA and penicillamine, and the prognostic test to be done is peripheral blood smear. Look for the basophilic stippling reducing or not. Then the cancers because of occupation, like most common is skin. 75% of all the cancer in occupational cancer is skin one. Okay, the PVC exposure leads to, the plastic exposure leads to angiosarcoma of liver. Asbestosis leads to mesothelioma. Then you have benzene causing leukemia, benzidine and alanine causing bladder cancer. Important one. It's a transitional cell carcinoma. Nickel, chromium, and wood dust leading to the nasal cancer, that is also transitional cell carcinoma. The radioactive and the silica are known to cause the lung, affect the lung. The lung cancer is common. Caisson's disease is affect the deep sea divers, and it's because of the low pressure, difference of the pressure in the lungs, and there's a bubbling of the nitrogen, that is bubbling, effervescence is bubbling, or there's effect of air expansion in the lungs. So what happens because of bubbling or nitrogen? Shortness of breath, choking, prickling, paralysis, and also aseptic bone necrosis happens. Something very unique, isn't it? This is what is Caisson's disease. And because of the air expansion, the difference in the air, you have the bursting or the baropressure difference in the ear. Okay, that is barootitis, barosinusitis, and then you have baroodontalgia, pain in the gums, tooth, and then we have emphysema when it is more severe. Lungs get expanded because of the air difference, pressure difference, and this abdominal distension as well. These all are features of Caisson's disease. One of the very frequently asked questions. More about this treatment of choice is the recompression of the chambers and giving hyperbaric oxygen therapy. Okay, so there's a science of in occupation, that's ergonomics, which is it studies the people's efficiency in the working environment, how to improve that and all. So that would be a right man in the right job. That would be the ideal situation. So when you fit the job to the worker, a doctor is given patients to see that will be fitting the job to the worker. And that is happening in pre-placement examination before the person joins. In post-placement examination, there are frequent and regular periodic examination based on the place they work. For example, if it is annual, it is done annually in most of the places. Health checkup, annual checkup of the employees. And if there's a radiation exposure, like people working in the X-ray department, they have to get checked every 2 months, and every month for the people who are working in lead, dye, and the radium industry, and daily for the people who are working in the dichromates. Again, remember this is important. The frequency is also asked. Sickness absentism, people fall sick and they take leave and the productivity is reduced. Okay, there are medical causes, non-medical causes. Non-medical causes like economic, like people get money, paid leaves, social, they want to avoid going, and others. And there's like around 10 days leave given per person per year for under Factories Act. Okay, so now the legislation, the Factories Act 1948. For the factory, when do you call it a factory is when you have workers of more than 10 and we don't have any power to work with, you don't need power to work with, then it's called as factory. And if you have power, okay, you're working in a place with using power, then you have, when you have people more than 20, we call it as factory. And this, all the rules in this will apply. Not applicable to people who are already having benefits like in defense, mines, railways, eateries, and food joints. The Children Factories Act clearly says no children below 14 years to be allowed to work in the factories. 15 to 18 can work, but the work hour duration should be not more than 9 hours per day. In overall week, if you say, it should not be more than 48 hours per week. And when they are working, maximum limit is put as 60 hours per week. These all three are maximum time that adolescent can work. So the other things which are required for a factory is one safety officer for every 1,000 workers, one welfare officer for every 500 workers, one canteen should be there for 250 workers, one nurse for 50 female workers. Okay. And in this act, you have 29 notifiable diseases, like you have seen 4 of that, pneumoconiosis, along with that others. And the per capita space is more required here. And one person should have at least 500 cubic feet space for him or herself. Again, a frequently asked question. ESI, you can see the symbol here. ESI was started in same 1948, not 1948, 1948. And its full form is Employees State Insurance. And then you have the Ministry of Labor, and chairperson is also Minister of Labor. And the contribution, like in the factory, the employer, the person who's the boss, should also contribute and have a pool of money that is 4.75 of his earning of that month or year. And then the employee also needs to contribute 1.75% of the wages. And this money which is pooled is distributed again back to the workers such that they get all the benefits under this. And center and state also shares, that is center gives 7 part and the state gives 1 part. The coverage is, all factories are covered in this more than 20%, and people who are having low income, that is less than 21,000 per month, they can avail this ESI. Not applicable for, again, for places which already have it like defense, mines, and railways. Okay, so what are the benefits? The medical benefit is like full medical care is given free of cost in ESI hospitals and tied up hospitals. And then sickness benefit is also given for 91 days max, that is 70% of the wage is given. This 80% also can be given for special circumstances for 2 years. Okay, and then the extended sickness benefit like 100% wages also given for particular, like people who are undergone just for vasectomy for 7 days, they get the full pay. And those who have got family planning done for women, that is tubectomy, then for 14 days they can avail paid leave. Then there's a temporary disablement benefit, that is till they recover they get 90% of the wage. Permanent disablement they get uh, till they're till they're able to work, or till not able to work, they still get the salary like a pension. Then you have the maternal benefit, that is 100% salary for 26 weeks they get. And the dependence benefit, like people when they die and they become dependent, they have the family who are dependents, they get 90% of the wages as pension. And when they die, there's 15,000 lump sum amount also given to cover the expenses of the funeral.